Dr. Emis is wonderful. He helps me get through life. I know that when I come to see Dr. Emis, I know I'm going to get the relief that I need.
I used to suffer daily from excruciating migraine headaches and neck aches. I went from doctor to doctor. Many of the doctors didn't believe the extent of pain I was suffering, and many of them put me off. Finally, I found Dr. Mark Emis, and he sat and he listened to what I had to say. Finally, I found someone who not only was caring and compassionate, but who was willing to work with me. And we worked together to find the right formulary in medication, injection, and other care so that I could live a normal, happy life. And now I'm pain-free. I come to Dr. Emis's office every 3 months. He gives me the right shots. I take the correct medication, and I'm happy, and I can live a normal, well-adjusted life. I wouldn't go anyplace else. I think Dr. Emis is one of the finest doctors, not only because he's an excellent physician, but because he listens. He listens to what you have to say. He cares about what you have to say, and he honestly knows what it means when you say, "I'm in pain." That means the world to me. It changed my life because I no longer am laid up every day. I don't wake up in the morning anymore wondering if I'm going to make it through the day. I know now that I can plan my days and I can have a full, happy life. I don't have to worry about not being able to play with my grandchildren, go with my husband, plan a trip, go to work. There are many days when I could not do those things because I was in such excruciating pain. And if on occasion, when I do have a breakthrough, all I have to do is call Dr. Emis. He sees me immediately, he takes care of the problem, he works with me, and I'm happy. I feel much relief just knowing he's there. I'm confident and I feel happy.
We are more than just one doctor. We're a team of pain management physicians.
You're going to get the relief
Right.
that you need.
Right. I know that when I come to see Dr. Emis, I know I'm going to get the relief that I need.
And maybe let's start that out. I look forward to coming to Dr. Emis because I know I'm going to get the relief I need.
I look forward to coming to see Dr. Emis because I know I'm going to get the relief that I need.
Perfect. Okay. And then so I've got that clip, and then I just want to redo the very first one that we did.
Should I say something about coming to him for about 5 years?
Sure.
I've been seeing Dr. Emis for approximately 5 years, of which he has helped me get through life. With Dr. Emis's expertise in the medical, that's stupid. With Dr. Emis's expertise, I know that I can depend on him for all my pain, for all my relief. With Dr. Emis's Dr. Emis helps me get through, I'm not looking at you, Dr. Emis helps me get through all the pain that I exhibit in life. That's not good either. Dr. Emis helps me, and I used to do this too, well, partially. What else? Oh, Dr. Emis, okay. I forgot what I initially said. What was I initially saying?
Well, it was about, Dr. Emis is wonderful. He helps me get through life.
That's right. Dr. Emis is wonderful. He helps me get through life.
Perfect.
Okay.
Good job.
Anything
you are done,
else?
sir.
That's it?
Like the smile. Now, we were talking a little earlier. You've been coming to Dr. Emis for how long?
About 4 years.
And it started with a surgery, I guess.
Yeah, it started before the surgery. He recommended the surgery.
Okay. And then you told me something interesting a while ago. Do you think Dr. Emis really helps you out in your life?
Oh, yeah. He actually gets me through life on a daily basis with the pain that I've been through. I don't know how that sounds, but he makes...
And when we say he, you're not going to hear my voice. So I always go, Dr. Emis.
Sure.
He gets me through life, especially with the surgeries I've had.
Let me ask you to just say this, get it out of the way, then we can keep up. Just say this with as much enthusiasm as you can. Dr. Emis is wonderful. He gets me through life.
Okay.
Okay.
And then you can just look right at me and say,
Okay. Dr. Emis is wonderful. He gets me through life.
awesome.
Okay.
Good.
That'll be my tagline. We'll go
So,
for-
and really, that's what we're going to, that's all I'm going to try to capture
Yeah.
again, but I want to get it to a way where it's spontaneous. So let's talk a little bit about Dr. Emis.
Okay.
Tell me what your experience
Well,
is.
see, I've known Dr. Emis because his sister is my sister-in-law.
Okay.
So I met him 14 years ago, and I started coming to him. Actually, it was about that when I first started coming to him, but I didn't experience the pain that I started to have. I had an accident about 14 years ago that kind of started the pain. I was in an airplane accident, and from there, it was recommended that I come to Mark or Dr. Emis.
Yeah.
I call him Mark, so, but I'll say Dr. Emis unless I forget. Then you can remind me.
Now, how difficult was it living with your pain?
Well, see, when I started, it was basically just some back pain. The back pain I was very sports oriented, and pretty much on a daily basis, which messed up my back to the point where I had spinal stenosis and I had pain from my back all the way down to my toes. So I could take a hammer and just knock on my leg and I wouldn't feel it. So it became pretty brutal at night trying to sleep. That was my biggest problem, is trying to sleep at night.
I'd like to hear you say something about it's wonderful to get relief without having to have surgery.
Okay. Yes. Yes.
We can't-
Because
Okay.
you mentioned you get these shots.
Yes,
do
I
they
do.
provide relief? So
I wouldn't say shots either, and no endorsement will include the word surgery, because
no.
we don't want it. And so, yeah, I would, something to the effect of, it's wonderful to be able to get relief without having to undergo surgery.
Yeah,
I
it's
wouldn't-
like through his expertise makes me get through life, helps me get through life.
And then so let's talk about that pain. Coming here helps you get.
The relief.
Sorry, it's
All
my,
right,
excuse me.
sorry.
It's, hey babe, where are you? Out front? All right, I'm coming right now, coming right now, folks.
So when you come to the spine center here,
Mm-hmm.
do you expect to get that relief?
Every time I come here.
All right.
I look forward to it.
So let's talk about that. Let's say
Okay.
every time.
I just have to tell you, I have to leave here by like 5 to 5 because I'm sure that's plenty of time. I have to get my daughter.
Oh, yeah.
I'm a single dad, so
Yeah.
I have no choice to.
Yeah, that's
Okay.
fine. So I look forward to coming to Emis and Spine because I know I'm going to get relief.
Should I say Emis in spine or Dr. Emis?
Either one?
Okay, I bet
What-
I think Dr. Emis is
Yeah.
more comfortable. for
Okay,
me.
I really look forward to coming to see Dr. Emis because I know I'm going to get the relief
Okay.
I need, or
Okay.
the way you said it a second ago.
Yeah, it gets me through life. Was it that one, or I know when I come to see Dr. Emis, when I come to see Dr. Emis, I know that I'll walk out feeling great. Oh, no, because it's not immediate. When I come to see Dr. Emis, I know that I look forward to coming to see Dr. Emis because I know I'll have relief.
Yeah. So,
Okay.
so let's just focus on me
Okay.
and just tell me that again.
Okay.
What you look forward to.
I know when I come to see Dr. Emis, I forgot what I was
Oh,
going to
that's
say. Here, you know what, Herb? I forgot to take my my memory medicine.
It's all right.
It's a vitamin, but I can't remember to take it. When I come to see Dr. Emis, I know that I'll walk away with. I know that.
Let's have you slide back that way just
Okay.
a little bit. Perfect.
Okay. I know that when I come to see. Are you recording this now?
Uh-huh.
Oh, okay. I know that when I come to see Dr. Emis, I'll try that again. I know when I come to see Dr. Emis, I always get relief.
Okay, and I'm going to have you just sit up here
Sure.
because I think that's going to keep you from moving.
Okay,
Oh, yeah.
I'm moving. Okay.
You're doing a wonderful job. I don't even have to say anything.
Noises.
Yes, too much noise.
I'll turn my phone off. Do you want me to go? Or do you want me to stop? Or do you want to ask me questions? Do you want me to continue talking?
Yeah, continue talking. I mean, what you were saying was all perfect. I'll get you led back into it.
Okay.
Let me just make sure my shot's looking good.
So you can rewind and put it back.
I mean, it's editing, so I can cut and take whatever I need. So I just take the really good parts.
Okay.
Judy, we were talking about you have excruciating migraines.
I did, but I no longer have those excruciating headaches.
They're not going to hear my voice. So maybe let's start out. I used to have excruciating migraines until I came to see Dr. Mark Emus.
I used to suffer daily from excruciating migraine headaches and neck aches. I went from doctor to doctor. Many of the doctors didn't believe the extent of pain I was suffering, and many of them put me off. Finally, I found Dr. Mark Emus, and he sat and he listened to what I had to say. Finally, I found someone who not only was caring and compassionate, but who was willing to work with me. And we worked together to find the right formulary in medication, injection, and other care so that I could live a normal, happy life. And now I am pain-free. I come to Dr. Emus's office every 3 months. He gives me the right shots. I take the correct medication, and I'm happy, and I can live a normal, well-adjusted life. I wouldn't go anyplace else. I think Dr. Emus is one of the finest doctors, not only because he's an excellent physician, but because he listens. He listens to what you have to say. He cares about what you have to say, and he honestly knows what it means when you say, I'm in pain. That means the world to me.
How do you think that changed your life?
It changed my life because I no longer am laid up every day. I don't wake up in the morning anymore wondering if I'm going to make it through the day. I know now that I can plan my days and I can have a full, happy life. I don't have to worry about not being able to play with my grandchildren, go with my husband, plan a trip, go to work. There are many days when I could not do those things because I was in such excruciating pain. And if on occasion, when I do have a breakthrough, all I have to do is call Dr. Emus. He sees me immediately, he takes care of the problem, he works with me, and I'm happy. I feel much relief just knowing he's there. I'm confident and I feel happy.
Oh, Judy, I want to hire you as my professional testimonial person. You're done. You were perfect. Thank you so much. And just looking at her, and action.
Hi, so you have a herniated disc at L45, and it's pushing up against the nerve right about here, and that's why you have leg pain going down the side of the leg into your foot and ankle. Doing this here?
Yep, so we'll start back with the spine,
Okay.
and then maybe we move over to the computer, and you can, like you're going to go through.
And then we'll screen this, and then you're going to cut.
Yeah, and then I can cut into that. All right.
I'm sorry, forget your name?
Christine.
Christine with a C or a K?
See?
C.
All right. And anytime you're ready.
How's the spine model over here?
It looks great. And then if I can just have you slide up just a little bit.
How's the jacket?
Jacket looks good. All right, and anytime you're ready.
So Christine, you have a bulging disc at 3-4 and L4-5. It's pushing back against the nerve here and here, and then it causes compression of the nerve. That's why you have pain radiating down your leg into your foot and ankle. So we can do an epidural. We're going to inject medication into this opening here. It's going to go inside the spine, up the nerve, and that should help alleviate a lot of your symptoms. Let's look at your MRI scan on the screen here.
Very good. Let's do that one more time.
Sure.
Maybe just spend about 3 seconds on the spine,
And then go here.
and then go there.
Got it, no problem.
All right, and action.
So you got a herniated disc at L3-4. It's pinching up against the nerve here. Let's look at the MRI scan together, and I'll show you what it looks like.
Awesome. You are done.
There we go. Just give you all these shots like that, right? sound anyway.
That's right.
I can do slower for you here. How do you black out the knee? Huh?
Well, it's so small now that
There's no way.
there's no way.
If you zoomed in, it'd be like.
Yeah, it'd be so pixelated, and you know. And I mean, if I have to, I could do a little mask where I just blur an area. Ooh, I like that one.
Oh, this is cool. Do a bunch of these for you. And you go to this one.
Oh yes, that's nice.
Are you getting both monitors or just one?
Both.
Oh wow, cool.
Well, it establishes that they're two, but then I'll probably be zooming in on the spine right here, which looks so cool. And then I would definitely want to see the name on that. Do the big one more time.
Okay.
Yeah, right there. All right. Thank you, sir.
Okay, very good, thanks.
And action.
So I have the needle all the way down here. What do you think there?
I think it's in the right spot. I think you have it right where it's supposed to be.
Okay, then I'm just going to go ahead and inject some dye and see it flow in the epidural space.
Yeah, I think it's going to work. I think she's going to.
And then I'm going to tuck the channel. It's going to be that way just a little bit. Perfect. I know it.
No, that's
Okay,
cool.
but it looks good. All right. And action.
Okay, so the needle stops right there. What do you think?
I think it's in the right spot. I think you have it right where it needs to be.
Okay, so I'm going to go ahead and inject some dye right there and see if we get an epidural flow.
Yeah, I think that's really going to help.
Dr. Enos, let's move you back some more.
Okay.
A little more.
Yep.
All right.
Right there.
Yep. And action.
I've advanced the needle up to that spot. What do you think?
I think it's in the right spot. I think we're going to get good flow. I think you did the right thing.
Okay, I'm going to inject a little bit of dye and see if we can get the epidural space in, okay?
I really think that's going to help her.
Okay.
I think it's good.
All right, very good.
Very good. Thank you very much.
Okay.
And action.
Sorry when to come in, okay?
You're on the action,
Okay.
so you're good right now. And action. Whoop. Let's wait just a little bit because you look like you knew he was coming.
Oh, okay.
So you're like psychic.
Got it.
Which
Okay.
I'm going to go to the psychic. And it might be a...
Oh, so wait till he's next to me.
Yeah.
Okay.
All right, stand by, the pin up, and action. 3, 2, 1. And I like your smile. Let's do a little smile with you,
All right,
because then you'll match.
You want to smile? I wasn't sure you want to
No,
smile.
I won't smile.
Okay, there you
Brad's
go.
from California. He practiced now.
Let's go ahead and just pull your door to just a little
Okay.
bit.
I'm smiling because there's going to be procedures involved. So.
All right,
Right.
and pointing with the pin, and action. 3, 2, 1. Good job. That's an awesome shot.
Should we talk? Pretend we're talking because our mouths are like not even moving.
Yeah, especially when you walk up, you're
I
saying,
think
this
we'll
is...
I'll just say stop.
Yeah.
All right. All right, and action.
Hey, Dr. Eva, so you take a look
Yeah.
at this. What do you think about this report?
Oh, you're leaning. So you lean in.
Me, I am.
Yep, so that's where you want to be right there.
All right. I'll stay straight up.
Yep.
Okay.
All right, and
Point.
action.
Hey, Dr. Eva, so I want you to take a look at this. What do you think about this stuff?
3, 2, 1. Good job.
That was pretty good.
You're done. And action.
So you have a herniated disc. It's located at L4-5, and it's pushing up against this nerve right here, and that's why it's causing pain down your leg through the side leg to the ankle. And we're probably going to do an injection where we put a needle right here, and we're going to put medicine inside the spine. And it's going to flow inside.
No audio. And action.
All right, so the needle's going here. What do you think?
I think you have it right in the right spot.
Okay, I think I'm going to stop there and then inject some dye.
Okay. I think that's good.
See how that
should,
works.
that should do it.